Paclitaxel-Eluting versus Everolimus-Eluting coronary stents in diabetes. Definition: Diabetes mellitus has reached epidemic proportions worldwide, and its prevalence is rising. The implications of a diagnosis of DM are as severe as a diagnosis of coronary artery disease. Cardiovascular mortality in all ages groups and for both sexes rises equivalently with DM or a history of myocardial infarction, and the two are profoundly synergistic. In addition, DM, especially type 2 DM, is associated with cluster risk factors for cardiovascular disease. Among adults with DM, there is a prevalence of 75% to 85% of hypertension, 70% to 80% for elevated LDL, and 60% to 70% for obesity. CAD is the main cause of death in both type 1 and type 2 DM, and DM is associated with a 2 to 4-fold increased mortality risk from heart disease.
One of the biggest problems for people with diabetes is trouble with their heart and blood vessels. Normally, your heart pumps blood to large blood vessels called arteries. In the heart, these are called coronary arteries. The blood, which is carrying oxygen, travels through the arteries until they turn into small blood vessels called capillaries. In the capillaries, the oxygen leaves the blood and enters your cells. Other blood vessels, called veins, then carry blood back to the heart. But over time, diabetes can damage the inside of blood vessels, including the arteries that supply blood and oxygen to the brain and heart. This damage allows a waxy, fatty substance called plaque to build up. Over time, this plaque can narrow or even block the arteries. When an artery in the heart or brain becomes narrowed or blocked with plaque, it's harder for enough blood and oxygen to get to the cells. In the heart, this can lead to a heart attack. In the brain, a stroke. In fact, people with diabetes are 2 to 4 times more likely to have a stroke or heart attack as someone who does not have diabetes. Many people with diabetes also have both high blood pressure and high cholesterol levels. This puts them at even a greater risk for heart attack or stroke. Although diabetes can hurt your heart and blood vessels, there are many ways to keep them healthy and in good shape.
Applications in medicine. The choice of drug-eluting stent in the treatment of patients with diabetes mellitus and coronary artery disease who are undergoing percutaneous coronary intervention has been debated. Previous studies comparing Paclitaxel-Eluting stents with Everolimus-Eluting stents have been produced contradictory results, ranging from equivalence between stents type to superiority of Everolimus-Eluting stents.
The development of newer cardiac stents has reignited the debate. Should patients with multivessel coronary artery disease undergo PCI or CABG? To answer this question, the BEST trial compared PCI using second-generation Everolimus-Eluting stents with CABG in 880 patients from 27 sites in Asia. Eligible patients had angiographically confirmed multivessel CAD and were considered to be suitable candidates for either PCI or CABG. Patients with clinically significant left main disease were excluded. At a median follow-up of 4.6 years, there was a significant between-group difference in the primary endpoint of death, MI, or target vessel revascularization, which occurred in 15.3% of the PCI group versus 10.6% of the CABG group. There was no significant difference in death or stroke between groups, but spontaneous MIs and repeat revascularization were significantly more likely to occur with PCI. The full trial results are available at nejm.org.
Pros and cons. Pros. Registries have shown Paclitaxel-Eluting stents to have efficacy and safety similar to those of Limus-Eluting stents. Everolimus-Eluting stents have been shown to be superior to Paclitaxel-Eluting stents with respect to both angiographic and clinical endpoints in most patients, but the results in the population with diabetes have been variable. Cons. Everolimus-Eluting stents could be less effective in this cohort, potentially making Paclitaxel-Eluting stents an attractive option. Everolimus-Eluting coronary stent system should not be used in patients who cannot receive antiplatelets and or anticoagulants therapy.
During the minimally invasive procedure known as PCI, a drug-eluting stent on a tiny balloon is threaded through the arteries to reach the narrowing in the heart. When inflated, the stent expands to the walls of the narrowed artery. The balloon is deflated and removed while the stent remains in place, providing a scaffold to keep the artery open. Blood flow is then restored, and the drug-eluting stent releases medication to allow healthy vessel healing around the stent, thereby reducing the chance that the artery will re-narrow.
Issue applied in Ecuador. Everolimus-Eluting stents have been shown to be superior to Paclitaxel-Eluting stents with respect to both angiographic and clinical endpoints in most patients, but the results in the population with diabetes have been variable. However, previous randomized trials were typically not sufficiently powered to assess the clinical outcomes associated with various drug-eluting stents among patients with diabetes. A randomized trial was performed to compare Paclitaxel-Eluting stents with Everolimus-Eluting stents in patients with diabetes. Conclusion. In patients with diabetes mellitus and coronary artery disease undergoing PCI, Paclitaxel-Eluting stents were not shown to be non-inferior to Everolimus-Eluting stents, and they resulted in higher rates of target vessel failure, myocardial infarction, stent thrombosis, and target vessels revascularization at 1 year.
Welcome to Insider Medicine in Depth. A new type of specially coated stent keeps coronary arteries open better than older stents with a different coating, according to research published in the New England Journal of Medicine. Here's some information about drug-eluting stents. Stents are small metal cylinders placed inside diseased or damaged blood vessels to help hold them open. Stents are most commonly used to treat blockages in the blood vessels feeding the heart. Drug-eluting stents have a coating that slowly releases a drug to help maintain the open blood vessels. Researchers from Columbia University Medical Center in New York randomly assigned over 3,500 individuals who required a stent to receive a new one that releases a drug known as Everolimus or a standard one releasing a drug known as Paclitaxel. The investigators then followed the participants for a year, looking at whose blood vessels became blocked again. The treated blood vessels became blocked again, causing death or a heart attack, or the need for another invasive treatment, among about 4% of those who received a stent that released Everolimus, compared with nearly 7% of those who received the stents that released Paclitaxel. The Everolimus-releasing stent outperformed the Paclitaxel-releasing stent among 11 of 12 subgroups of patients studied. The exception was a subgroup of patients who suffered from diabetes. Today's research suggests that a newly available drug-eluting stent could provide even better outcomes than the current standard drug-eluting stent. For Insider Medicine In Depth, I'm Dr. Susan Sharma.